Schematic diagram of brachial plexus. Roots join to form trunks. Upper trunk C5 C6 supplies upper muscles like shoulder, scapula, arm muscles. Middle trunk C7. Lower trunk C8 T1 supplies distal muscles like hand muscles. Erb's palsy C5 C6 upper trunk are compromised. Klumpke's paralysis C8 T1 lower trunk are compromised, that is lumbricals and interosseous muscles are compromised. Root value for various nerves. Musculocutaneous nerve C5 C6, axillary nerve C5 C6, ulnar nerve C8 T1, radial nerve C5 C6 C7 C8 T1, median nerve C5 C6 C7 C8 T1. Upper trunk gives two branches in the neck region. Suprascapular nerve, nerve to subclavius muscle. Radial nerve and median nerve have all 5 root values of brachial plexus. Middle and lower trunk do not give any branch in neck region. Dermatome of hand, thumb C6 dermatome. Middle 3 fingers C7 dermatome. Little finger C8 dermatome. Myotomes C5 C6 supply the proximal muscles of shoulder, scapula, arm. In Erb's palsy, injury of C5 C6 upper trunk of brachial plexus. Patient has difficulty in shoulder abduction and elbow flexion. C8 T1 supply the distal muscles, hand muscles. Klumpke's palsy, injury of C8 T1, claw hand deformity is seen. Development of limbs, upper limb rotates laterally by 90 so that thumb will come laterally in anatomic position. Folds anteriorly, therefore flexor compartment lies anteriorly, extensor compartment lies posteriorly. Development of limbs, upper limb rotates laterally by 90 so that thumb will come laterally in anatomic position. Folds anteriorly, therefore flexor compartment lies anteriorly, extensor compartment lies posteriorly. Lower limb rotates medially by 90 so that great toe will come medially in anatomic position. Upper limb lateral, lower limb medial. Folds posteriorly, therefore flexor compartment lies posteriorly, extensor compartment lies anteriorly. Erb's point, it is the meeting point of 6 nerves, root of C5, root of C6, suprascapular nerve, nerve to subclavius, anterior division of upper trunk, posterior division of upper trunk. Erb's point is the site of lesion in Erb's palsy. Erb's palsy, nerves involved, cause of injury, clinical features. Duchenne palsy, upper trunk C5 C6 injury. Suprascapular nerve, axillary nerve, musculocutaneous nerve, radial nerve. Undue separation of head and neck, fall on shoulder, birth injury. Clinical features, Erb's palsy, adduction and medial rotation at shoulder joint, extensor at elbow joint, pronation at radioulnar joint. Klumpke's paralysis, nerves involved, lower trunk, C8 T1 injury, median nerve, partial injury, ulnar nerve, T1 sympathetic fibers. Hyperabduction of arm, holding a branch while fall from a tree. Birth injury, sports injury. Klumpke's paralysis, clinical features, claw hand deformity because lumbricals and interossea injury. Horner syndrome, ptosis and meiosis. Klumpke's paralysis clinical features are claw hand deformity, Horner syndrome, ptosis, meiosis. Claw hand, normally there are 4 lumbrical muscles, 4 palmar interosseae, 4 dorsal interosseae. These muscles helps in flexion of metacarpophalangeal joints, extension of interphalangeal joints. Lumbricals and interosseae work along the extensor digitorum muscles for interphalangeal extension. Extensor digitorum, it is a muscle of posterior forearm. It forms the dorsal digital expansion and dorsum of fingers of hand. This dorsum digitalis expansion is more important for interphalangeal extension. Lumbricals and interossea are inserted at dorsal digital expansion, therefore helps in interphalangeal extension. Lumbricals and interossea are inserted at dorsal distal expansion, therefore helps in interphalangeal extension. In Klumpke's palsy, lumbricals and interossea are not working. Then anterior and posterior forearm muscles become more powerful. Therefore, extensor digitorum muscle becomes more powerful and causes metacarpophalangeal hyperextension. Flexor digitorum profundus muscle becomes more powerful.